Welcome to the Exam Room Live, brought to you by the Physicians Committee. Hi, I am the weight loss champion, Chuck Carroll, and this is the healthiest half hour anywhere online today. Appreciate you joining us right here on Facebook and on YouTube. Going to do our best for the next 30 minutes to both educate and inspire you. On tap, slaughterhouses continue to be a major concern of outbreaks of the coronavirus surging among employees. The current measures, not enough. And now a growing number of voices are banding together to call for a boycott of meat. Dr. Neal Barnard will be here with the latest. Dr. Barnard, looking forward to catching up with you, sir.
Hi there, Chuck. There's a lot to say today.
And we're going to be opening up the doctor's mailbag. So if you have a question for the good doctor, go ahead and post that in the comment section now. We will be opening that up, pulling one out at random and getting you an answer by the end of the show. Also on tap today, he is a globally recognized authority on lifestyle medicine who has been working on the front lines in the fight against COVID-19. And she is the director of clinical research here at the Physicians Committee, tag teaming a segment on the response of COVID-19 here in the U.S. Compared to Europe are Dr. David KATZ and Dr. Hana, Kahleova. Thank you both for joining me today.
Good to be with you, Chuck.
And before we go any further, let's get you caught up with what's going on in the world. Here are your health headlines for Wednesday, June 24th, 2020. A new wave of coronavirus infections continues in 7 states now, reporting record hospitalizations, including Texas and California, where health officials both say there were 5,000 newly diagnosed cases on Tuesday. Both of those single-day records, according to the Washington Post. Nationwide, 33 states are averaging more cases this week compared to last, and Tuesday also marking the first daily increase in the number of COVID-related deaths in the last 2 weeks. Researchers in Texas say they have found a better way to look at good cholesterol. A group from UT Southwestern Medical Center says by examining the often overlooked HDL particles, doctors can better predict the odds a patient will have a heart attack or stroke. A study finds those with the highest levels have a 37% lower risk of a heart attack and 34% lower risk of stroke. The findings, especially strong among women, risk factors for both conditions cut nearly in half. However, the study also finds no correlation between any HDL measurement and heart attack and stroke among African Americans. Meanwhile, in Canada, the federal government is making a big investment in plant-based foods. Prime Minister Justin Trudeau says the country is investing $100 million in a Winnipeg facility that creates plant-powered protein. Some of the funds will also go to support farmers who will be supplying the crops. Said Trudeau, quote, "As people around the world start eating more plant-based food products, we have an opportunity to bring together innovation in Canada and Canadian crops and a chance to create good, well-paying jobs." Well wishes to tennis star and vegan advocate Novak Djokovic, who has tested positive for the coronavirus. The world's #1 ranked tennis player is believed to have contracted the virus while playing in a charity tournament that he helped organize in the Balkans. 4 other players, as well as his wife and trainer, have also tested positive. Djokovic is apologizing after facing criticism for running an event with, quote, zero social distancing guidelines. The Serbian star says he will self-quarantine for the next 14 days. And finally, to live a long life, you need to have good genes, right? Well, new research says that what your mommy and daddy gave you will only get you so far. A study published in the International Journal of Environmental Research and Public Health finds people who live in urban walkable communities with neighbors of all ages are more likely to live to see 100 years old. The chances of having triple-digit candles on the birthday cake also increased for those living in affluent, smaller towns. Previous research has shown hereditary factors account for just 20 to 35% of a person's chances of becoming a centenarian. Let's move on now. As of this morning, more than 25,000 cases of coronavirus can be tied directly to meat packing facilities. The virus has hit nearly 240 plants, stretching across 33 states, tragically claiming at least 100 worker lives. And it is becoming more clear by the day that the danger is only increasing despite the safety measures being put in place. And now a growing number of people are standing together to fight back against this edict from Washington that meat is essential. And for that, let's turn to Dr. Neal Barnard. Dr. Barnard, earlier this morning, you took part in a press conference regarding the fight for the safety of the workers and calling for a boycott on meat. Really, Is a lack of demand for meat really the only solution here?
It's a good solution. I have to say, getting people away from meat is a really good solution to lots of things. And it was the League of United Latin American Citizens who called for a meat boycott. And what they're getting at is this: there you have lots and lots of workers in these slaughterhouse facilities. And when you pick up your chicken or pork or beef or whatever at the store, the question might be, who was the last person who had to deal with this product and what kind of conditions were they under? Well, you hinted at the statistics. As of yesterday, the Food and Environment Reporting Network said there have been 27,888 cases of COVID-19. I'm talking about workers testing positive in the slaughterhouses in the United States, 99 deaths as of yesterday. We reported this before, but presumably the most hygienic person in the slaughterhouse is the inspector. The last time the data were updated, there were 200 cases among the inspectors and 5 deaths among the inspectors. These have stopped been reporting, so there are very likely more now, but we just don't have further data. So anyway, where are we with this? Let me unshare my screen and come back to you. Okay. This morning, our friends at the League of United Latin American Citizens said we've just got to boycott meat. That's the thing to do. And the Centers for Disease Control and Prevention came out with a new set of recommendations that make all this even more troubling. And I have it right here. What they said is slaughterhouses are a place that are going to remain hotbeds unless something is done. And what they said is you've got to increase distance between workers, and that the fact that they're packed closely together is part of why these are hotbeds for the virus. The duration of contact is an issue. Long working hours, the type of contact. People are not only close together, but they're also sharing implements and handles and doorknobs and all kinds of things. And in many cases have shared transportation. So the Centers for Disease Control also set out some guidelines. This is to be read by people who work in a slaughterhouse. And part of it says, try to keep 6 feet away from other people. And you have to say, try to do this. And these are workers who don't have the ability to rearrange the kill floor. These are people who want a paycheck and they don't want to die from it. So anyway, LULAC today said enough is enough. We're just going to boycott meat altogether. And one might think, how can you do that? Well, remember Cesar Chavez, a generation ago, said workers are dying in the fields, and he said boycott the grapes. Now, in this case, it's a different thing because there wasn't necessarily anything wrong with the grape, but there's a lot wrong with the meat, whether people are boycotting it for the workers, for the animals, for the environment, or for their own coronary arteries. So we were more than happy to support this and to join in with a meat boycott. And I'm hoping that this will be something that people will do not just temporarily, but permanently. And Chuck, if you don't mind, let me just parenthetically mention, I grew up in North Dakota. My dad and his extended family were in the cattle business. They're good, decent people. But as we have come to understand the industry, it looks an awful lot like the tobacco industry, where you get people who are promoting a product that it ends up being bad for all concerned, and getting away from it is a good idea. So back to you, Chuck.
Let me play the role of a critic here, devil's advocate, if you will. Somebody might say, well, is this really just an issue in slaughterhouses, or might we see this among workers who are working out in the fields right now, and then maybe the processing plants for things like bag salads? Is the risk any greater among meatpacking workers?
Yeah, it is for a number of reasons, and that's why the CDC issued this report. They wanted to say, there's risk anywhere people are, of course, but they said, what is the reason with the meat industry and the poultry industry? Those are the ones that they completely singled out. And part of the reason is what we described, is people really spend their whole time indoors working on carcasses one after the other. Often the temperatures are kept low, and at refrigeration temperatures, the virus, the novel coronavirus, will last for weeks and weeks and weeks. And as you know, at freezing temperatures, it lasts indefinitely. So you're working in a refrigerated or cooler environment. The products are then refrigerated and sent out, and the workers are just basically standing in place for a long period of time. They can't get out. Also, they already did wear a certain amount of protective equipment before COVID arrived. They are now being issued more, and that obviously has to happen. But as they don this equipment, it gets them personally hotter. The environment maybe is cooled down. They personally get hot. They sweat. The sweat can drip down their face onto the products, and it's just one where the workers themselves say, you know, this is just not a life, and they're right.
All right, Dr. Barnard, appreciate that. If you have a question for Dr. Barnard, go ahead and post that in the comments section now. We're going to be opening up the doctor's mailbag in just a little bit, so now is your time to get your question answered. I got to tell you, my next guests, simply put, are a couple of health dynamos. Dr. David KATZ is a preventative medicine specialist and globally recognized authority on lifestyle medicine. He also happens to be the author of the book How to Eat and the founding director of the Yale Griffin Prevention Research Center and the founder and president of the True Health Initiative. And joining him, Dr. Hana Kahleova. You know, she's been on the show before. She has her hands in so much cool research. It's not even funny. She's the director of clinical research here at the Physicians Committee. Welcome to you both. Thanks for joining the Exam Room Live.
Thanks for having us, Chuck.
Thank you, Chuck.
Dr. KATZ, I want to start with you because I understand that you actually spent some time working on the front lines of the COVID-19 response here in the U.S. Before we compare that to how things were in Europe, can you kind of set the table for us a little bit? How was that experience for you?
Well, important to me, Chuck. I'm an internist first. I did sequential residencies and I went on to do preventive medicine because so much of what happens in internal medicine doesn't need to happen. But I took care of patients for 30 years. I stopped a few years ago to focus on public health. But when New York was so beleaguered and the call went out for volunteers, I'm licensed, I'm credentialed. I thought, I've got to be among them. As it turns out, I was one of the earliest. When I got to my hospital in the Montefiore system in the Bronx, they said, we've had nurses come in, but you're the first doc who's come in to support. And it was important for me because, I did get pulled into commentary on the policy responses to COVID because I was looking at the big picture, thinking about public health. But I felt it was really important to fortify that perception, seeing this up close and personal, seeing what the bad cases look like. So it was intense. I can tell you one thing, that it's bad not to have an N95 respirator when you need one. It's no walk in the park to wear one for 12 hours straight either. Your nose is really sore at the end of the day. But I think I helped some people. I was pleased to lend support to my colleagues. And then finally, Chuck, what I want to say is thank you to the clinicians who have been frontline from the beginning through the end. I was a drop in the bucket. I did a few shifts to help out. But there are folks who've been in this from the beginning, and we really appreciate them.
You and Dr. Kahleova recently teamed up to write an editorial on the response here in the U.S. versus over in Europe. Dr. Kahleova, we just heard what Dr. KATZ said, but how is that experience differing from what we have seen in Europe, where there hasn't been this prolonged decrease, or in this case now a resurgence of cases?
Yeah, that's a great question. Europe was kind of criticized for closing their borders, even amongst each other. So even in between the European Union countries. The Czech Republic was one of the first countries that closed the borders on March the 12th. But that also enabled these countries to open up the borders again in a safe environment where they were able to contain the pandemic and entered the stage 4 of reopening their countries. While in the US, the response was fairly delayed. In March, there were restrictions on travel with China, but the response was super slow to ban the travel from Europe and from Italy particularly. That took another few weeks. And also we see the delay in containing the pandemic. We see the numbers still going up in many states in the US.
Dr. Katz, let's follow up on that. Compared to, the measures that Dr. Kahleova there was just talking about, how would you say that we should be doing things differently here in the States? What would help us really bring down these numbers?
Yeah, so we haven't done anything right. We dithered in the beginning where there were lockdowns. They came later than they should have. Now we're opening up parts of the country where there hasn't been a first wave yet, and we're inviting the first wave. We never carefully protected the highly vulnerable from exposure. This is a bad infection in older people and people with chronic illness. It's usually a very mild infection in young, healthy people. We failed all along to differentiate the protections that we accorded those two populations. So I actually don't think any country has done this completely right. There are arguments for what Sweden has done, but Sweden failed to protect their nursing homes as robustly as they needed to. They failed to protect their older citizens. And then countries that have locked down completely, the exact opposite of Sweden, like, for example, New Zealand, they're in big trouble because until there is a safe, effective, mass-produced, universally distributed vaccine, nobody can leave New Zealand and come back. Nobody can go into New Zealand because they're basically a petri dish waiting for the pandemic to arrive. So I've been opining from the start that, first of all, we need to think about total harm minimization. There are harms of the infection. There are also harms of shutting down society. And we need to think about risk stratification. We can identify these many weeks into the pandemic, we can identify the populations where there's a high risk of complications, severe infection, hospitalization, death. We need meticulous protections there. And then we can identify people where the risk of exposure to this particular pathogen is not much greater than risks we encounter all the time. We're very unlikely to have a severe case. Most of us might even have an asymptomatic bout. And most pandemics do end with herd immunity rather than vaccines. So letting people who can get through this safely get exposed actually is part of what needs to happen. I think maybe it is what has happened in New York. So I would argue we haven't managed this optimally anywhere in the world. And maybe we didn't have the necessary knowledge. We do now. We ought to apply it. So we ought to be thinking risk stratification, total harm minimization. And yes, we should be developing a vaccine. Yes, we need improvements in treatment, which are coming fast and furious. But people who can safely get through this and develop antibodies, that is part of the formula that ends pandemics.
How has your opinion on COVID-19 changed since that op-ed that you wrote was in the New York Times that was so widely publicized? There was quite a bit of feedback on the highest levels on that piece. Has your opinion just changed at all since that time?
I don't think so. Interestingly, I was arguing very broad principles, Chuck. And, if you get into details where you have a lot of uncertainty, you're going to be wrong about some things. I really didn't get into details. So, I basically said two things at the start, and they remain true. And if anything, I feel more strongly about them now. One, there will be harm not just from infection here, but from 40 million people unemployed. We know how important in public health the social determinants of health are. When people are unemployed and food insecure and desperate and destitute, really bad things happen, and we're seeing those trends. So that really worries me. And the other is that there are massive differentials in the risk of bad outcomes from SARS-CoV-2. We saw that very early on with the data out of China and in particular South Korea, and it's now corroborated by data all around the world. When Northern Italy had these very high mortality rates, they were massively compressed in people over 70 and people with serious chronic disease. Young, healthy people were not dying in Italy. Young, healthy people were not dying in New York. It happens, but it's an anomaly. And of course, young, healthy people occasionally die of anything else that happens very rarely to young, healthy people. So all of those cases are getting widespread media attention, making us think they're more common than they are. They're rare. And severe cases in children, very rare. So actually, I would still argue, just as I did at the start, total harm minimization, not just preventing spread of the virus, and risk stratification. Protect the vulnerable, but don't shut down society in those areas where exposure to this pathogen is not all that dangerous. And young, healthy people are likely to have a mild bout of this. And we have more and more data to support that now.
Dr. Kahleova, I want to turn to you. Clearly, as they say, you can't put the toothpaste back in the tube, but let's hypothetically say that we can. And let's hypothetically say that we can go back, 5 years or so. And at that point, 5 years ago, everybody adopts a plant-based diet. So focusing on the preventative medicine side of things, where we know that a plant-based diet can really reduce the risk of so many of the chronic comorbidities that are being associated with the COVID-19 pandemic. So if everybody had been eating a plant-based diet 5 years ago, would we still be in the dilemma that we face today?
Yeah, that's a fascinating question. As Dr. KATZ mentioned, it's more about protecting the vulnerable populations. Now, the challenge in the United States is that with such high rates of obesity, 38% of Americans are obese, with such high rates of cardiovascular disease and other chronic diseases that increase the risk of retracting the infection and also developing the complications. Basically, it puts the average American at risk. So we're talking about the need of a major shift in our lifestyle in order to reverse this. And a plant-based diet is an effective way how to do it, together with increased physical activity. If everyone in the United States changed their diet into a plant-based diet, we would see a substantial decrease in obesity rates, but also in cardiovascular risk, and also in other chronic diseases such as diabetes and cancer. We pulled together an editorial. We were editing a special issue on vegetarian dietary patterns in the prevention and treatment of chronic disease for the journal Frontiers in Nutrition. And 10 leading researchers published their papers in this issue. So we summarized the findings in this editorial. And one of the papers focuses on cardiovascular disease specifically. And the authors analyzed the data from 7 prospective studies from almost 200,000 participants. And they found out that a vegetarian dietary pattern reduces the mortality from cardiovascular disease by 22% and incidence of cardiovascular disease by 28%. And that's self-reported vegetarian dietary pattern. We're not even talking about other measures of the diet quality. Of course, we know that you can also be a junk food vegetarian, but even then, when you combine all vegetarians together, they still have much lower rates of cardiovascular disease. So nationwide adopting of a plant-based diet would result in substantial improvements in public health.
Plenty to discuss. I wish that we had more time, but we're going to have to leave that right there. I am excited to announce that Dr. David KATZ will be joining me on the Exam Room podcast very soon. We're going to do a deeper dive into this, as well as answering a really interesting question is, what is he going to be talking about at the upcoming International Conference on Nutrition and Medicine? One of his presentations there is called Eating as If the World Depended on It. So what does he mean by that? Well, we're going to talk about that coming up on the Exam Room podcast. And by the way, ICNM, the International Conference on Nutrition and Medicine, coming up August 6th through 8th. You can register right now at pcrm.org/ICNM. Dr. Kahleova, Dr. KATZ, thank you both so very much for taking the time to join us here today.
Thank you.
Thank you, Chuck. Good to be with you.
All right, time now to open up the doctor's mailbag. Dr. Barnard here now to answer one of your questions. And Dr. Barnard, today's comes to us from YouTube. It's actually a viewer in Alaska, as a matter of fact. They want to know, can people without access to fresh vegetables get enough iron on a low-fat, whole food, plant-based diet?
Well, greetings to our friend from Alaska. Thank you for submitting that question. Yeah, the short answer is yes. Where does iron come from? Iron is an element. It's in the earth, and it goes through the roots of plants, and it ends up in the plant's leaves. So green plants have lots of iron in them. Now, some people think of iron as coming from meat. The only reason that happens is because cows eat green vegetables. In their case, they eat grass, and hopefully you're not doing that, but kale and collards and broccoli and Brussels sprouts all have lots of iron, and it's highly absorbed. There are a couple of exceptions where the iron is a little bit less absorbed, but for the most part, it's highly absorbed. For extra credit, iron exists in a couple of different forms. In meat, it's called heme iron. In plants, it's called non-heme iron. But non-heme iron is the one that our bodies are really designed for, because if you need more iron, your body doesn't have much on board. You tend to absorb more of it than you would otherwise from the plants. But if you are teetering on the edge of iron overload, your body is able to shut that iron out. And that's important because iron can damage the heart, iron can damage the brain if you got too much of it. So green leafy vegetables, best source. There's also iron in beans and a number of other foods. But you just said, well, I'm in the middle of a place where there's not a lot of fresh stuff around. Frozen vegetables, from a nutritional standpoint, are about the same as fresh. And if you think about it, you pick them, you quick freeze them, the nutrients stay there. And when it comes to iron, canned still works as well. Now, you're right, canned vegetables, some of the nutrients are gone, but iron is an element. Iron is there for as long as that can stays on your shelf. The iron's not going to go away. So do get your vegetables. Fresh is always great. Frozen is equivalent to fresh. Canned is a little bit behind, but you'll still get iron there too.
And I have to add that I never saw Popeye eat fresh spinach. It was always out of a can, and he was just strong as an ox, right?
Well, he's our role model for all of us, isn't he?
All right, Dr. Barnard, greatly appreciate your time today, my friend.
Thank you.
So often on the show, we are also asked, where can I find a good plant-based doctor who knows all about this stuff? Well, the good news is that doctor does in fact exist. And thanks to the wonders of telemedicine, they can come right to you. You can make an appointment to visit with any one of our plant-based doctors and dietitians at the Barnard Medical Center, who do put nutrition into laser focus as they seek to treat the cause of the problem and not just the symptoms. So to make an appointment, head over to barnardmedical.org or pick up the phone and call 202-527-7500, 202-527-7500. You see that number on your screen right now. New patients being accepted for those living in California and New York, Washington, D.C., Maryland, Virginia, Missouri, Arizona, Colorado, Massachusetts, and Kentucky. A number of those states really in the midst of a big spike in coronavirus cases. So now is definitely the time to really take a close look at your diet and how you can get on the path to a healthier future. barnardmedical.org or 202-527-7500 to make your appointment today. Before we go, I want to give a special shout out to Vic Hauptman. He is the founder of Cruelty Free You and Me in Chicago. This past weekend, in honor of Father's Day, Mr. Hauptman helped to organize a plant-based food drive for African-American dads in the Windy City. The efforts resulted in 75 bags of plant-based groceries and prepared meals being distributed to those in need. He tells Veg Out magazine, quote, "We wanted to ensure that all dads, including Black dads, felt love, support, and appreciation on this Father's Day." And indeed, they did. Our hat is off to you, Mr. Hauptman, and to all those who pitched in to make the event such an incredible success. And my thanks again to Dr. David KATZ for joining us here today, and the crew that makes the Exam Room Live possible. Our director, Emily Colon, and our producers, Donna Steele and Laura Anderson. On behalf of Dr. Neal Barnard and Dr. Hana Kahleova and everyone here at the Physicians Committee, I am the weight loss champion, Chuck Carroll. Thank you so very much for watching today. And until tomorrow, remember, take a stand, stay safe, and keep it plant-based.